Welcome back. An Ebola outbreak is often viewed primarily as a public health emergency, but a new report by the United Nations Development Programme reveals that its impact stretches far beyond hospitals and clinics. According to the assessment, the current Ebola outbreak in the Democratic Republic of Congo could push nearly 1 million additional people into poverty, eliminate thousands of jobs, disrupt healthcare and education, and cost African economies billions of US dollars if the crisis worsens. The report also highlights that women are being bearing a disproportionate share of the burden, as many work in informal cross-border trade, service frontline healthcare workers, and are primary caregivers within their families. But to help us better understand these findings and what they mean for the region and the policy responses being proposed, we're joined by Dr. Raymond Gilpin, who is the Chief Economist and Head of Strategy Analysis and Research at UNDP Africa. Dr. Gilpin, thank you so much for joining us here on the Daily Roundup. Now, this report describes the Ebola outbreak as not only a health emergency, but also a development and economic crisis. What prompted the UNDP, firstly, to examine the outbreak from this broader perspective?
Thank you so much for having me on. This crisis is peculiar because if you compare this crisis with the first 100 days of prior crises, it's much more virulent. So far, we've had 1,300 confirmed cases, almost 300 confirmed deaths. We also see the case fatalities much higher. These stats push countries and communities to address the medical side of the emergencies. But ever since this was deemed to be a public health emergency of national concern in May, we have been worried that there are spillover effects that could threaten long-term development. For example, traditional containment models that emphasize clinical tracking, quarantines, etc. are good, but they could also have adverse impacts on informal trade, on public revenues, and also they could degrade institutional trust. These are things that undermine the development prospects, not just for the affected areas, but for whole countries. And this is why we decided to also explore the development side of the crisis.
One of the report's most striking findings is that nearly 1 million more people could be pushed into poverty. How did the UNDP arrive at that estimate, and what are the key factors driving such a significant increase?
Yes, we took a look at the impact of the pandemic, and we used some econometric modeling to get at the 985,000 people figures, but we also compared it with what we have learned from prior medical emergencies like previous Ebola crisis, the COVID challenge. And we found out that indeed there are two key channels. First will be the impact on households. Because of the spiking food costs and the potential for lost wages, we estimated that the bottom 20% of households will contract economically almost immediately. And this gets worse the longer the health emergency continues. And secondly, we estimated that because of some of the containment measures that include travel restrictions, etc., we found out that families and businesses would lose significant amounts. And these families do not have the usual financial buffers or savings that are necessary to weather the disruption. And because of that, we could think about the impact of prior Ebola outbreaks, think about the impact of global conflict that has also increased inflation in these communities. And because of that, we don't have the usual financial buffers. And if you combine the lost income and the absence of financial buffers, we would definitely see thousands, up to 1 million, being pushed back into poverty.
The report warns of economic consequences for neighboring countries and the wider African continent. How interconnected, Dr. Gilpin, are these economies? Why does one outbreak in one country have such widespread implication?
For most countries, particularly in the region, if you take Uganda, the other country of concern, we find out that the economic ripples do not stop at the border. They cross the border because there's a lot of movement of people, a movement of goods and services. Regional supply chains exist. And because of that, we see not just the possibility of transmission across borders, but we see transportation delays, border restrictions, and declining consumer confidence, all affecting the economies in these regions. For neighboring countries, the combination of these supply chain bottlenecks and inflation spikes definitely affect the availability of food, basic consumer items, and also investor confidence.
You introduce a concept called smart borders within the report as one of these solutions. What does this approach involve? Why is it considered more effective than this widespread travel and trade restrictions?
Yes, as I mentioned earlier, the travel and trade restrictions impose a tax on businesses, particularly the small businesses that are struggling to survive. When you have the closures, when you have illegal crossing points, etc., it does affect trade, and it does affect the survival of the communities and also of businesses. Smart borders would mean that rather than just shutting down the borders, to implement health checks at the borders, integrate community-based protection systems where local market associations, cross-border traders are trained to monitor and report symptoms. Smart borders would also allow, trade to happen without being truncated, and affected the way it has been in previous Ebola outbreaks. So here we're trying to see how we could balance community safety and controlling and containing the outbreak with the economic survival of the communities that involved.
One thing that's also touched on, Dr. Gilpin, is a concern around the disruptions to routine healthcare services, and this could lead to thousands of infant deaths unrelated to Ebola. How can governments, strike a balance between responding to this outbreak while also ensuring other essential services remain available?
Yes, this is a really difficult issue. Because we look at in our estimates, we're seeing up to 2,500 excess infant deaths in the DRC alone. Although not entirely from Ebola, but also Ebola-related causes. And this is something that we think is unacceptable. And therefore, what happens when Ebola strikes, or when we have these kinds of health care emergencies, we see the entire health system taking a zero-sum approach to addressing the challenge at the expense of other essential services, particularly for infant child care, immunizations, malaria treatments, maternal care, etc. And these vital services tend to collapse. So what we are suggesting is that measures are taken to protect these essential services, like ring fencing, emergency financing, also ensuring that you have dedicated staff to keep maternal, reproductive, and basic pediatric clinics fully operational, that are separate from the Ebola response. And this way we have this important balance so that we don't end up with these excess infant deaths that we identify.
Dr. Gilpin, for countries that have not reported Ebola cases, this is including many across southern Africa, what lessons should policymakers take from this report to strengthen preparedness before an outbreak even occurs?
Okay, and I think that there are three that I would share. I think first we have to understand that panic, knee-jerk panic, close the borders, build the walls, it not only creates severe economic shocks, but it unnecessarily compromises healthcare outcomes in the outer years. So the first point would be to really understand this relationship and ensure that policy responses are balanced sufficiently so that we don't have us throwing the proverbial baby out with the bathwater. Second one, I think it's important for countries to immediately invest in cross-border health monitoring systems, community-led data tracking, and start considering how best to put in place some flexible social safety nets even before the emergency occurs. And thirdly, I think it's important to for countries that haven't experienced Ebola yet to have clear regional frameworks for trade and transit continuity, so they don't get disrupted if a neighboring country reports a case. And of course, have smart border screening to ensure that we don't have this economic instability and people being pushed into poverty. Lastly, it's important for countries to take the virus seriously, because as we saw in West Africa about a decade ago, these viruses cross borders quickly and they could create significant mayhem, both from a healthcare perspective and also a socioeconomic perspective. So that unaffected regions pay attention, be prepared, and don't assume it wouldn't get as far as your borders.
Doctor, we appreciate your time. Thank you so much for joining us this evening here on the Daily Roundup.
You're welcome.
Well, that was Dr. Raymond Gilpin, the Chief Economist and Head of Strategy Analysis and Research at the UNDP Africa, speaking to us about their report on Ebola and the widespreading consequences. He was joining us there from New York. We'll be right back after this short break.